Let's talk health now. And public medical stores risk shortages of drugs and non-medicine consumables. Now, medical stores at public health facilities risk an imminent shortage of drugs owing to the depreciating cedi against the dollar and recent price hikes. The Health Service Supply Chain Practitioners Association of Ghana says many bidders to public health facilities have returned procurement lists seeking upward adjustments of previously allocated prices of medical commodities. There is more in this report.
The current economic situation is biting hard on the procurement and supply chain sector. The Health Service Supply Chain Practitioners Association of Ghana, at its 14th annual general meeting in Kumasi, bemoaned challenges confronting medical stores at public health facilities. National President Stephen Sechi revealed the worsening economic situation has truncated the supply of certain medical products in parts of the country.
We are looking at the current economic crisis. We all know what is happening. What is the certain is that tenders that were floated, every tenderer or every supplier, let me use the word that everybody can supply, suppliers that bought tenders from the facilities that will say they will supply this and that, they have all come back written to all the facilities that there should be upward review of prices or they can't supply. Some will not even respond and they will not supply at all. This is it's causing a lot of stockouts in the system right now, and it has disrupted the supply chain. A supplier quoted for maybe 50 pesos of paracetamol, a tablet of paracetamol 50 pesos, which they import mostly. So with the current economic and how the dollar is behaving, now they will write back to the facility that they can't supply at the 50 pesos. They want an upward price adjustment. So maybe they can supply you at 70 pesos or 1 cedi. And look at the burden it's going to bring to the facility.
Currently, most public health facilities have no allotted funds for procurement of non-medicine consumables. Stephen Sechi is imploring the government to institute a policy to allocate permanent funds for such products.
When we say non-medicine, we are talking about exams, gloves, syringes, gauze, and all those things, etc. Even comes to buying of beds and all those things, equipment for the facility. But here is the case that money has been lumped together with the service charge for NHIA. So when NHIA reimburses us, and that money, as I have expanded, is used for all administrative expenses at the facility, including procuring non-medicine. So as always, we don't have the funds available to procure non-medicines. And this is creating a lot of issues in the system now. Because when you go to the facility now, sometimes you might not even get simple gloves for the facility, the staff to use, because the funding are not there. And even the service charge that insurance pays is too woefully inadequate.
The AGM was on the theme Sustaining Ghana's Health Supply Chain with Improved Research and Data. Director of Supplies, Stores and Drug Management Division of the Ghana Health Service, Araba Kudiabo, wants the government to immediately resolve the human resource deficit in the supply chain sector.
The need to respond quickly and decisively on issues of supply chain is now. Dr. Chair, the perennial issue of inadequate supply chain professionals across all levels need to be addressed as soon as possible to ensure the sustainability of these supply chain reforms. And I'm happy the ministry is here, and I wish the ministry engages the Ministry of Finance and gets us financial clearance for the recruitment of supply chain professionals.
Director of the Procurement Unit of the Ministry of Health, Dr. Edward Ejekum, urged the professionals to support the ongoing framework contracting policy for efficient operationalization in the health sector.
The implementation of this important initiative is bedeviled by some challenges, mainly the high level of indebtedness due to the delay by the National Health Insurance, resulting in surprise refusing to supply medicines under the framework to beneficiary institutions. The ministry will kindly solicit the support of all expert members at all levels across the country to support the successful implementation of the framework.
For JoyNews, Emmanuel Bright Kweku reporting.